Hello, everyone. Welcome to episode 2 of the State of the Heart podcast. I'm joined here by Dr. Ghandi. He's a surgeon at BC Children's Hospital. And so, how are you doing?
I'm great. How are you?
Good, thanks. So I'm just going to ask you some questions about what it's like being a surgeon.
Sure.
So, I guess one of my first questions is, what equipment do you use for heart patients during surgery?
Oh my gosh, we use all sorts of equipment from stuff that we use before the operation to diagnose kids with heart disease that I'm sure Dr. Sanatani talked to you about, echocardiograms and cardiac caths, CT scans, MRIs. It's all gotten very technological these days. We can even make 3D models of the heart.
Wow.
To get a better idea of what problems kids have. And then, of course, in the operating room, we have all sorts of equipment that's required to fix kids' problematic hearts. So most kids need to go on what's called a heart-lung bypass machine. So that's the biggest piece of equipment that we have. And that machine supports the heart and the lungs during surgery. There's also tons of anesthesia equipment that's required to keep kids asleep safely and effectively.
Yeah.
And then, of course, the operating room equipment, all the instruments that we use, ranging from saws to open the breastbone to all the very intricate instruments that we need to repair the heart. And we have them. The unique part about Children's Hospital is that we have to have these things in a whole bunch of different sizes because our patients can range from tiny little things less than a kilogram in weight to teenagers like you who are essentially full-grown adults.
Yeah.
So we have a whole host of equipment that we use in the operating room, and then there's a similar whole bunch of equipment used in the intensive care unit to take care of kids afterwards.
Okay. So it's a lot of equipment.
It's a lot of equipment.
Wow.
Very pricey.
Yeah. How long is usually heart surgery? What's the shortest amount of time and what's the longest amount of time?
I mean, as you know, kids are born with a whole bunch of potential different heart problems. 1 in 100 kids is born with a congenital heart defect, and those can range from quote-unquote simple things like a hole in the heart to very complicated things where kids are born with 1 pumping chamber instead of 2. Kids have arteries that come off their heart that are flip-flopped. The heart can literally be inside out, upside down.
Wow.
So operations can range anywhere from 2 hours to 10 hours.
Wow.
Depending on what needs to be done.
Wow, that's a lot. That's a long time. When you, I guess the next question would be, when you walk into the room as a surgeon, is everything like prepared and ready to go, or what's your role to get the surgery going?
Well, I mean, it's a team effort. So kids are brought into the operating room, and then the anesthesiologist sort of starts off things. It's sort of the anesthesiologist you can think of as is starting the engine of the plane and landing the plane. So takeoff and landing, and everything in between is sort of the surgeon. But we help at the beginning too if necessary. So the anesthesiologist puts the baby to sleep or the child to sleep, and then starts intravenous lines and gets what's called an arterial line, which measures the blood pressure. Sometimes we put a special line in the big veins to allow us to have access to the circulation. And most of the time the anesthesiologist does that. Sometimes the surgeons need to help if gaining that access is difficult. Then there's also, for the vast majority of kids, we put what's called an echo probe in, which is, you've had echocardiograms before, but in the OR we do it, put the probe in through the mouth, so the echocardiogram looks from behind the heart rather than on top like you're used to when you're awake. And so all that preparatory stuff gets done. The nurses do a bunch of preparation, a catheter in the bladder, all sorts of things. And then we're ready for takeoff.
All right. Well, that's a lot of. So it's a lot of steps to get ready.
It's about a 45-minute to 1 hour preparation, depending on the complexity of the operation before we actually start. So from the time the child enters the operating room till the time a skin incision is made.
Wow. What was your journey in getting or in becoming a surgeon? Like how long did it take?
It was a long journey. No shortcuts, unfortunately. But when I did it, the journey was a little bit different than the journey is now. But so I went to medical school after undergraduate. And then at that time, you had to do a full, what's called residency in general surgery. So not heart surgery, but general surgery, like surgery of the other parts of the body, like the abdomen and things like that.
Yeah.
So that was a 5 to 6 year process,
Wow.
depending on what you did and where you did it. And then after that, I specialized in cardiac surgery or heart and lung surgery. But that wasn't specifically for just children, it was for everybody.
Yeah.
So that was another 2 years. And then I decided to do pediatrics, so kids' heart surgery. So that was another year after that.
Wow. So 6 years, 5 years, and another year. So that's
So undergrad's 4, medical school's 4, that's 8.
wow.
And then 5, for me it was 5 years of general surgery, so that's 8 and 5 is 13, and 2 years of cardiac surgery is 15, and a year of pediatrics 16 years after high school.
That's a lot of years. Wow.
Yeah, so when you graduate from high school and you think you're all done with it, you haven't even scratched the surface.
Yeah. What's the best part of being a surgeon?
Oh, that's easy. The best part of being a surgeon is the ability to take a sick kid and within a few hours make them all better.
Wow.
And especially the kids, the babies that are really sick, that are born and they're blue, and then you take them to the operating room and rearrange the plumbing of their heart and they come out pink and all's good. So it's a very gratifying, almost selfishly gratifying profession.
Yeah. So is there like any being nervous, like what if something goes wrong? How do you
Yeah, like I think the day you stop getting nervous is the day you should quit doing it.
Oh, really?
I get nervous every day. You know, no matter how many operations I've done or do, you always worry that that something won't go right or the heart won't respond the way you want it to respond, even though your instinct tells you otherwise. You know, we stop the heart to do the operation, and then we have to start it back up, and there's always that few seconds of, you better start.
Yeah. Yeah.
So, I think there's always a little bit of trepidation in the kind of work that we do, because you're dealing with the lives of somebody's kid.
Yeah.
And
So it must be a lot of pressure.
I mean, I tell people it's not flipping burgers for a living. Not that there's anything wrong with flipping burgers, but it's, you know, if you flip the burger the wrong way, you can throw away the patty and start over again.
Exactly.
So in our world, that's not the case.
Yeah.
And so, I think you have to be a little bit on edge and a little bit nervous every day.
Yeah. Were you ever worried that, like, did you ever have any trouble in schooling? Like, at one point, did you ever say to yourself, like, I can't do this? Or were you always positive and overcome your fails and then succeeded?
No, I don't think. I mean, once I decided this is what I wanted to do, I sort of had a singular focus in achieving the things that were necessary to do it, and I always knew I could do it. Pediatric heart surgery is not necessarily the easiest thing from a technical perspective, so there's always a little bit of doubt in your mind. Can I put those hearts back together as well as the people that taught me to put them back together? But I think anybody going into this profession has to have the mindset that they're able to achieve what they think they can and what others achieve. Otherwise, it won't work out right from the beginning.
Exactly. So did you? So I guess what was the hardest? Actually, what was the hardest surgery you could? I mean, if you could think of one, what was the hardest surgery you ever did?
Oh well, I've done a lot of operations that have been pretty challenging. There was a patient I operated on when I worked in the United States that had a whole bunch of operations, including a lung transplant, and I was doing his second lung transplant. So it was a reoperative lung transplant after a whole bunch of previous heart operations.
Wow.
And that was pretty awful.
Yeah.
It was very challenging from a number of perspectives. The operation took over 12 hours, and it was a difficult post-operative course. But it didn't help that it started at, I think, 11 o'clock or midnight. So it was that was a challenging day.
Wow.
Few weeks.
Yeah.
But there have been several like that have been challenging. It's sort of like climbing a mountain. It always feels better when you're at the top.
Yeah, exactly. Did you said you worked in the States. You worked in St. Louis, right?
I worked in Pittsburgh and St. Louis.
Pittsburgh and St. Louis. How did you end up with a job at BC Children?
Well, I'm Canadian, so I grew up on the East Coast. I went to medical school in Montreal. And I always kind of wanted to raise my kids in Canada and come back to Canada. So it just so happened the way things worked out, I got jobs in the United States, and I was there for a long time. And then when this job came about, they contacted me, and one thing led to another, and
nice.
I moved.
So, how do you prepare for if a patient who just got off of the ambulance? How do you prepare in time for surgery?
Well, the one good thing about our job is that, or my job is that, in this day and age, in 2018, there are very few kids that need like emergency operations like right away. There are some. There's some babies and some other kids that need to go to the OR right away, otherwise they'll die. But most of the time, there's a period of stabilization after a child shows up.
Yeah.
So you do have a little bit of breathing room. So it's not like they go from the ambulance to the operating room, with some exceptions.
Okay.
And the times that's necessary, you usually have a little bit of advance notice that they're coming.
Okay.
And things can be prepared in advance.
All right. So going to back to 2 years ago, during my cardiac arrest, you performed the surgery, and
you're talking about when we put the ICD in.
Yes.
Yeah.
The ICD, and so what experience did you go through? Did you like?
Well, when you came in,
yeah.
I mean, our first concern was, were you going to be okay?
Yeah.
Because anytime anybody has an out-of-hospital cardiac arrest, you don't know if they're going to be okay or not.
Yeah.
A lot of it depends upon when the cardiac arrest happened, and then who found you and what they did afterwards.
Yeah.
And luckily your dad was there and knows how to do really good CPR. So, it became evident that you were going to be okay. And when we say you're going to be okay, it's really your brain that we're worried about.
Yeah.
'Cause
it's not the heart?
No.
Oh.
It's not the heart. I mean, it can be the heart. It can be any organ.
Yeah.
But the brain's the most susceptible organ to damage after a cardiac arrest. So usually, even if it takes a while, usually the heart will recover.
Okay.
And the kidneys recover, and the liver recovers, and the gut recovers, and all that stuff recovers. But the brain, if it's had lack of oxygen or blood flow for even a short period of time, can have permanent damage. And the problem with the brain is it's a little bit amorphous in the sense that you don't really know what kind of damage. It's not predictable necessarily.
Yeah.
So sometimes the damage is such that you just lose some fine motor skills, or your memory's not as good, or it's a bit vague. And sometimes the damage is obvious, like you're blind, or you can't move part of your body, or even worse, you're not able to talk and do normal things, like you have severe brain damage.
Yeah.
So we always have to give it some time to sort of figure out what's happened. And it was obvious that you weren't going to have any of those big problems. Then we proceeded with putting in the ICD.
Okay. So cardiac arrest can have some side effects to it as well. So like blindness and paralysis.
It can have a lot of side effects, mainly related to the brain. There can be side effects related to the heart and other organs too. But the brain's the one we worry about the most.
All right. So do you know how a cardiac arrest starts?
Well, there's a lot of different ways a cardiac arrest can start.
Okay.
And it depends on the circumstances and the heart. People, you've heard of kids that have quote unquote normal hearts that have a cardiac arrest when they're playing basketball or something, and that's oftentimes because they have a heart defect that's not been picked up. You can have a cardiac arrest in older patients because they have blocked arteries, coronary artery disease, and they have a heart attack, which results in a cardiac arrest. Wow. Or you can have an abnormal heart rhythm where your heart beats in a weird way, and kids that have had previous surgery like you are susceptible to that when you have an abnormal heart rhythm that causes the heart to beat in a very disorganized fashion, and that leads to cardiac arrest.
Okay, so when I came off the stretcher or came off the ambulance and I was on the stretcher, how long was it for everyone to prepare the surgery?
Well, again, we didn't prepare surgery for you right away.
Okay.
We waited for several days because...
Oh, really?
Yeah,
okay.
Because there was nothing... You didn't need surgery at that point. You needed to be stabilized, make sure all your organs were okay, and try to figure out why you had the cardiac arrest. And then, when it was determined that it was likely a heart rhythm problem, that's why you got the box, as we call it, or the ICD.
Yeah. So also another is this a side effect? I'm not too sure, but you can't remember anything when you wake up. Is that common, or is that a side effect?
Very common. Yeah.
Okay. So is that because like you hit?
Well, you kind of black out. When you have a cardiac arrest, that means there's no blood going anywhere, including your brain.
Oh.
So you sort of you become amnestic, or you have amnesia, or a lack of memory around that time. It's kind of like when you have surgery and they put you to sleep. You kind of don't remember anything around that period, or certainly after. Yeah.
Okay. That's very interesting. Well, how you don't, like, I guess.
Like we make sure the anesthesiologists give you medicine on purpose to make sure you don't remember anything.
Okay. Also, it actually makes you not remember anything.
Yeah, like that's one of their goals. So one of their goals when they put you to sleep are to put you to sleep safely, to keep you asleep safely, to make sure you don't have any pain during surgery, and to make sure you don't remember anything.
Okay. Wow. I didn't know. I thought to be honest, I thought that just put you to sleep. I didn't know you forget.
Yeah, no, they really want you not to remember anything.
Wow. That's really interesting. So another question I had for you was, do you get like any, being a surgeon, do you get like any special stuff you get to do? Like, do you get like extra days off, or because like you work long?
Exactly the opposite.
Oh, really? Because you work long hours, so sometimes for long surgeries.
It's an interesting question. there are no perks to the job in the sense that nobody's bringing you extra muffins in the morning or stuff.
Yeah.
But those kind of perks.
No coffee?
Nobody's bringing your coffee. No red carpets, man. But the perks really are internal self-satisfaction perks. So you can talk to all the doctors around here, and we're in a closed room. I know this is going to be a podcast, so it's going to be on the internet somewhere, but everybody will hear this. But all these doctors, all these cardiologists and ICU docs and everybody, they all do a spectacular job. They all do a terrific job, and they're all part of a very important team to take care of kids with heart disease.
Yep.
But none of them, except me, gets to play with the heart and to actually fix what's broken.
Oh, really?
Right? Like, I'm the carpenter in the whole deal.
Okay.
So it's I'm the one putting the nails in and hammering the floorboards together to build the house, kind of thing. You know what I mean?
Yeah.
So you can take a lot of self-satisfaction in kids that are doing well, that their heart was all screwed up, and you're the one with your hands that made it better. There weren't no machines. There wasn't any this or that. It was just your hands cutting this, sewing this, putting this part back to that part, and that's what made it better. So that's a huge perk in my mind. That's a huge benefit of the job. It also causes some of that added pressure that you talked about, but that's a big perk. But there's no other like extra job perks. In fact, days off are rare.
Really?
I mean, I come 7 days a week.
Yep.
And see the patients every single day, and that's just the way it is.
So you don't So are you on call most of the time?
All the time.
Okay. Wow. So busy job then. Very busy. Sound like a very busy job.
Yeah, I mean it's it fills the days.
Yeah. So yeah, I think that's all the questions I had for you.
Great.
Thank you so much for being on the podcast.
Oh, you're welcome.
I really appreciate it.
Yeah. Well, I'm glad you're doing it. I look forward to seeing it.
Yeah. Thank you. And before you go,
send me a link or something.
I will. Yeah.
I'm not that technologically advanced, but I can click on a link.
Okay. And before you go, I actually have I got a T-shirt for you.
Well, thank you very much, Daniel.
You can wear that at home or whenever you want.
I'm glad you're doing so well, and
thank you.
And thanks for doing all this.
All right.
All right. Great.
All right. So this was episode 2 of Stand Up Podcast with Dr. Ghandi. Thank you so much, and see you later. Peace.